Hello, everyone. Good morning, good afternoon, good evening, from wherever you're joining us from around the globe. I am Larry. I'm from the FIP ECPG Publications Committee, and here we have Dr. Shania Liu, which is a multi-award winning hospital pharmacist. She will be sharing some insight on her part in hospital pharmacy and some of the great exploits she has done, especially one of our major contributions is highlighting some standards and guides to pain management and opioid stewardship, which is quite used all over the world now to improve access and efficient use of these medicines. So, Dr. Liu, do you want to give a brief introduction of yourself?
Of course. Thank you very much for that introduction, Lanry. My name is Shania Liu, as Lanry's introduced, and I'm a pharmacist working predominantly in hospital settings and a postdoctoral researcher currently. I trained and practiced as a hospital pharmacist in Australia, where I completed my PhD in improving the safe and appropriate use of pain medicines, and am now doing my postdoctoral fellowship in Canada. Throughout my career journey, I've been actively involved in a number of different pharmacy associations too, including Advanced Pharmacy Australia and the FIP in the Hospital Pharmacy Section and the Early Career Pharmacy Section.
Thank you very much for that introduction, and I'll go straight into the questions. Can you tell us a bit about your career journey to your current role?
Absolutely. So I commenced my career in hospital pharmacy in an internship at Prince of Wales Hospital in Sydney, which is a tertiary metropolitan teaching hospital in Sydney, Australia. So that gave me experience in working in hospital wards all around the hospital. So, for example, looking after people who had just received surgery or those who had come in for a heart attack, who were undergoing uh, potentially bypass surgery for a heart attack that's being put in, as well as in situations such as the emergency department. And we also had Sydney Children's Hospital next to the Prince of Wales Hospital, which I worked in to gain experience in paediatric pharmacy in the hospital setting, as well as in the Royal Women's Hospital, so more obstetrics and gynecology. So quite a broad range of experience there. But some highlights include working closely with the hospital acute and chronic pain team, where I was able to work closely with our pain specialists, our medical team, our nurse educators and nurse specialists in pain, and really to advise upon the appropriate dosing and use of strong pain medicines, such as opioids, for a whole variety of pain conditions in the hospital.
Oh, amazing, amazing. That's quite some experience working across boards of hospitals, and it's quite impactful. Thank you very much for your response. So this question is about your career choice for hospital pharmacy. What was your experience like working in the hospital pharmacy? What did you enjoy the most about this practice? What were some of your key highlights or Eurocamp moments while working as a hospital pharmacist?
Yeah, absolutely. So as I mentioned, working closely with different multidisciplinary teams was definitely a highlight working in the hospital setting. So, for example, you're able to liaise with people with different expertise and provide your own expertise as a medicine specialist, as the pharmacist on the team. I also really enjoyed working directly with patients. It was really rewarding to be able to see the impact of recommendations or clinical interventions that you've made to improve the care and the safety of someone who's in hospital and acutely needing healthcare right in front of you. For example, someone who might have kidney dysfunction might need a lower dose of certain medicines, such as antimicrobial agents or opioids, to avoid side effects. So as a hospital pharmacist, I particularly enjoyed providing clinical insight as the medicines expert on the team to improve my patient's outcomes. And it was very rewarding to do that. So that was definitely a highlight. Other highlights were certainly the broad diversity of clinical areas that you can work in a hospital. So, as I mentioned, there's cardiology, all the way ranging to intensive care, to gynecology, to internal medicine. So, really a variety of clinical areas that you can rotate around in a hospital, provided you have a hospital of that size where you can gain that differentiation in clinical experience. And certainly, each area is so different, and being able to have both breadth and depth of knowledge is a great perk of working in hospital pharmacy.
Thank you very much for that response. That was quite the experience, working in different multidisciplinary teams and seeing, the lived experience and impact of your interventions. I think that's something that one would really look forward to in the hospital pharmacy practice, right? As the interventions are being implemented, you see the real life changes, you see the real impacts in the patients and how they get more comfortable and they improve in their overall health outcomes. That's really interesting. Now, we are going somewhat into your research. So, what sparked your interest in research?
Yeah, so a couple of things have sparked my interest in research, particularly pharmacy practice research. So, the first thing that sparked my interest is being able to make a meaningful change in outcomes for my patients. So, what do I mean by this? So, say I'm looking after a person in a hospital. Maybe I'm making a recommendation to prescribe certain medicines, such as strong pain opioid medicines at a safer dose. After working in hospital pharmacy for a number of years, I noticed similar misconceptions or mistakes being made day after day, year after year. And to be able to make meaningful change on patient outcomes, I found that being able to conduct clinical research show evidence of perhaps poor outcomes resulting from current medication use practices, and how we can use medicine more safely or appropriately using different strategies. This allowed more meaningful change in patient outcomes, because this type of research can be cited into clinical guidelines, can be used to inform hospital policies on how to more safely use medicines in the hospital. This over time can improve patient outcomes through a broader impact, and can lead to a longer lasting change in these positive outcomes. So that's the first reason. Another reason, which is tied to this, is that not only does research allow more sustainable change, it also allows more broad reaching change. So, for example, a particular piece of research that you conduct can be cited in a hospital policy and lead to long lasting change in that hospital. But it can also be cited in, say, statewide or province wide guidelines, national guidelines, and impact positively patient outcomes across the scale of, say, hundreds, thousands, tens of thousands of patients. Whereas if I were working in hospital pharmacy, yes, you would be able to make meaningful impact on the one person in front of you, but to be able to make change at a larger scale is also very rewarding in a different way. So a couple of different reasons why I have been engaged in research, but certainly they have been the main reasons.
Amazing. Thank you very much for your response. I really appreciate the patient-centered approach and passion for research, how research can provide evidence of what is being done right or wrong, And through that evidence can inform policies, can inform guidelines, both at the local level and at a broader overreaching level. And I think this is quite important for young pharmacists, to leverage research to improve patient care, to leverage research to provide evidence on how to improve health outcomes across the settings, whatever settings they may be in. And this is something I'm going to adopt from this interview too, to try to maximize research to provide evidence at both the local and the global level. This next question is more focused on your work. You've mentioned that your work developing the opioid guidelines have helped not just at the local level, but also at the global and national level, informing guidelines. So what was your experience working on that? What were some of the challenges you encountered as a young pharmacist trying to initiate this research, to develop these guidelines? What were some of your challenges and how did you overcome them?
Yeah, so these were standards to guide how pain should be managed by hospital pharmacists in Australia as a part of my role as the chair of the Pain Management Leadership Committee of the Association Advanced Pharmacy Australia. So that pharmacy association represented hospital pharmacists and more across Australia. So overall, it was a fantastic experience working closely with other leaders in pain management around Australia who developed these standards. We had a section on existing and emerging pharmacist roles, and it was particularly exciting being able to shape and to see what current and future practices of pain management might look like. So, for example, something that is an existing pharmacist's role in pain management might be advising on appropriate dosing of particularly strong pain medicines, such as opioids. And maybe an emerging pharmacist's role might be perhaps co-prescribing pain medications in a safe and appropriate manner with medical colleagues. So that was definitely a highlight of my experience. It was also a great experience working with different leaders in pain management around the country because this allowed me to draw from others who had experienced particular areas of pain management. So, for example, some of our team members worked in particularly pediatric pain management, so for those less than the age of 18, or in cancer-related pain management. So these areas are areas of pain management that I did not necessarily have in-depth experience in. So on one hand, it was a challenge being put in the position of writing a position standard on how it should be managed across the country, but it was great to be able to draw upon fellow leaders across Australia in how these areas of pain should be managed. So that was both a challenge and a highlight. And I certainly found that by leaning on the expertise of my team, we were able to produce much higher quality standard of practice, which was much more comprehensive than what one person alone could do, drawing upon one person's experience, which is not realistic to reflect the whole body of pain management. I also found that in our standards, another section that was challenging was writing recommended staffing ratios on how to staff hospitals. For example, how many pharmacists each hospital should allocate to pain management services. This was an issue because some hospitals might be smaller and only have a handful of pharmacists for the whole hospital, and to dictate a certain number of pharmacists to work on pain management may be hard to generalize, whereas other hospitals may be much larger and have different resources available. This is probably a similar case for some countries where countries may try to adapt guidelines from other countries to their own. And I imagine some of your members may be experiencing similar things. So it's certainly challenging to generalize recommendations from one setting to your own, but that was a challenge that we also experienced in our standards of practice. The way that we overcame this was that we were very clear that these were guidelines only, and we gave ranges when it came to staffing ratios for pain management services, and we also gave parameters in terms of what core functions should be and what extra function could be. So that served as a guide as to how these services should be carried out.
Oh, wow. I think that's a very good example of teamwork can make the dream work, because by leaning
Mm-hmm.
on the support and expertise of other colleagues and team members, we're able to overcome quite a lot of the challenges. I also appreciate the critical thinking that went into the document, because you were able to not just look into the present, but also kind of forecast like what could the future roles of pharmacists in pain management be. And I think that's one element that is really stood out for me. Then one thing you also mentioned was the flexibility of the guidelines, how you clearly stated that it was not just a one size fits all approach, but in implementing the guidelines, they should be cautious of their settings and make sure that they adapt the guidelines to the individual setting. And I think this is one key factor that really makes the guidelines stand out, in the sense that due to that flexibility, differentiating the core functions from the some functions that may not be so essential, kind of gives it this applicability, if that fits into the context, that it can be used in almost any setting around the world. Thank you very much for that. Now, this is still related to your guideline, still related to that critical thinking part, where I said you're able to forecast the roles of pharmacists in the future. So, based on your experience, your knowledge, your expertise, how do you see the role of hospital pharmacists evolving?
Yeah, it is an exciting time to be in pharmacy and in hospital pharmacy. So I recently wrote an article with Advanced Pharmacy Australia on this topic, and some expanded roles of pharmacists, including hospital pharmacists, include potentially coordination of vaccination clinics, so certainly relevant after the COVID-19 pandemic, as well as the administration of vaccinations. So, for example, when I worked in a vaccination clinic myself during the COVID-19 pandemic, I certainly saw firsthand the role that pharmacists can play in delivering vital vaccinations to people in a rapid manner. And this was certainly needed at that time in the community. Another area in which hospital pharmacy is evolving is in partnered pharmacist medication charting. So, if in case viewers of this interview are not familiar with this, this is where a pharmacist and a medical officer might review a person's medication plan, agree upon potential changes that are needed, and agree upon a medication plan moving forward. And then the pharmacist charts, so prescribes the medications according to the agreed plan that was discussed with the medical officer. So this can happen in a number of settings. For example, in emergency departments, this can happen to help improve the rate at which medications are given to patients when they come into the emergency department. And this can help to improve patient flow through the emergency department, just so that our emergency departments are not as clogged up, and that we have better transition through into the hospital and back home, discharge from hospital as needed. So that is a key area that I'm involved in terms of research to see how pharmacists can contribute in partnered pharmacist medication charting. Another area that this already happens is in highly protocolized medication settings. So, for example, some cancer medication plans follow very strict protocols, particularly in Australia. We have strict protocols for certain cancer types. So in those settings, I know that pharmacists do sit down with medical officers and together they prescribe medications for the patient according to those protocols. And as you go through, pharmacists can make recommendations on required dose adjustments for potentially kidney dysfunction, as I mentioned, and other conditions which might also make an impact on how those cancer medications are processed by the system. Finally, another area that I see medication management by hospital pharmacists. Currently, I am working in Canada and I see pharmacists prescribe medication. So this is more shifting from hospital into the community, but certainly pharmacists here can initiate a much broader range of medications than many parts of the world. So, for example, they can initiate medications for the management of cardiovascular disease, diabetes, and this can provide enormous alleviation to the workload on the health system. So, this has been something that has been highly effective in the province of Alberta in Canada and continues to serve patients in terms of improving their access to healthcare.
Amazing. Thank you so much for your response. The future of pharmacist role in hospital pharmacists, it looks really, really bright, and I really agree on the collaboration with the medical officers and doctors to guide the prescription of medicines and their input, especially in those adjustments and in the medication reviews. I think this will go a long way in contributing to patient safety and improving health outcomes. And for the vaccination, I think it just reiterates the FIP stance on think health, think pharmacy, because pharmacists leading this vaccination efforts, even in the hospital, kind of puts pharmacists as leaders and potential public health leaders and advocates that can also play a role across the health sector, from disease prevention to management to treatment and also rehabilitation. So the future for hospital pharmacists is really, really bright, and I'm so glad that we see some of these things happening already. So this question is more about your involvement in professional organizations. You've mentioned some of the associations in Australia. So do you want to talk more about your experience in professional organizations and how have this experience contributed to your growth? How have they helped shape you? And what are some of your key takeaways from your experience with this professional organization?
Yeah, absolutely. So I have been actively involved in a number of professional organizations and certainly have found it to be extremely rewarding. So, a couple of highlights. As I mentioned at the start of this interview, I am actively involved in FIP's Hospital Pharmacy Section, and we have fantastic guidelines on how hospital pharmacy should be practiced around the world. So these are called the Basel Statements, and if you like, I can share a link to the Basel Statements for anyone who is interested to take a closer look after this interview. And if any members are interested in getting actively involved in using the Basel Statements in their own practice, I would certainly encourage them to reach out to me and I can direct you in the appropriate direction. Another area in which I have taken on leadership positions is in Advanced Pharmacy Australia, as I mentioned, through the Pain Management Leadership Committee, in the FIP Hospital Pharmacy Section through their Communications and Digital Engagement Committee. And now I'm also co-leading a position statement on the appropriate use for opioid use in acute pain in the International Association for the Study of Pain. So that's IASP. If any of your members are interested in learning more about this position statement, I can certainly provide some information on that too. And we are seeking expressions of interest to join a Delphi panel, so basically a way to have your voice heard in this position statement. So if any of your members have any experience in pain management or interest in pain management and would like to join the Delphi panel, I would definitely encourage them to put forward an expression of interest. Overall, I've found, as I said, engagement in professional associations to be extremely rewarding and has really grown my international network of collaborators. This has been an opportunity to not just get to know, but also work closely with leaders around the world in my clinical areas and also areas of professional interest. And I highly encourage any of your members in the FIP ECPG to get actively involved in a professional organization group. Maybe it is ECPG, maybe it is other associations as well. If there are any members who are interested in the associations that I've mentioned, they are very, very welcome to reach out to me and I can get them more actively involved and actually doing something in these associations. I think my takeaway message would be to become actively involved rather than just a passive member, because that not only makes you stand out as someone who is keen and engaged and able to help, but also as someone who is then able to derive more benefit from that network by actively working with colleagues internationally. That's my take-home message there. Get actively involved.
Experience. I totally agree with you, right? I think just as Nike said it, just do it. So just go get involved, just go start, join the FIP, the FIP CPG. And I think this is really important because just as you said, it increases your network, you get to work with experts, you get to learn from other people's experiences, and it's also very, very rewarding. It gives you quite a number of hands-on experience, especially in the international space. I totally agree with you, and I also second that everyone gets involved at whatever level they can get involved in at their local level and also at the FIP. Um, so this next question is, what are some of the key skills that young pharmacists need to excel in the hospital pharmacy?
Yeah, that's a great question, Lanry. So I would say the key skills are number one, it's important to have curiosity. So it's important to acknowledge that you might not know everything in the hospital, and practicing as a hospital pharmacist is definitely an ongoing learning experience. So if there's anything that you don't know, I would definitely encourage you to ask. And the more curious you are and more questions you ask, the more knowledgeable one becomes over time. I also think that teamwork in hospital pharmacy is incredibly important, as we've discussed today, not only in hospital pharmacy, but also in research, in professional organizations. All of that lends very favorably upon working effectively as a team, right? So it's very important to work with multidisciplinary clinicians, with other leaders in your research area around the world, in other teams in your professional organization. And I truly believe that it is by working with good people and by being supported by good people that you are able to achieve much greater things and go much further than if you were to be working alone. So teamwork is an incredibly important skill to have. Last but not least, I think um, the active engagement requires both initiative and also resilience. So there are many times where not all things will go your way, and it really is important to have resilience to continue to pick yourself up. So tying back to the first point of curiosity, whether it's hospital pharmacy, professional association roles, there are times where you might make mistakes or where you might not know everything, and it's completely fine to make mistakes as long as you learn from them, have the resilience to take what you've learned and bring that forward. So I think that's a very important skill to have in hospital pharmacy and really many professions.
Thank you, Dr. Liu, for that response. It's really, really important that, as pharmacists, we are lifelong learners, just as the FIP puts it. And I think that's where curiosity kind of fits in perfectly, always trying to learn and be a better version of yourself. Teamwork and resilience. Teamwork, resilience. Resilience, I totally agree. Not everything goes, the way you want. And this is kind of going to lead us to the next question, right? So how can hospital pharmacists contribute to leadership in the hospital setting? How can they, promote participation in some of the work that they do to kind of make what they do more visible and also to contribute to leadership decision at the hospital?
Yeah, great. I completely encourage hospital pharmacists to become more engaged and active in leadership positions. I think there are a number of ways that hospital pharmacists can promote more active um, visualization of the work that they're doing. So to make the work that they're doing more visible and also to become more prominent in potentially leadership positions. So first, I think pharmacists can join executive committee groups where they are representing hospital pharmacy on multidisciplinary committees. So some hospitals that I've worked at have decision-making committees where pharmacists will join a committee alongside nurse representatives, medical officer representatives, and hospital administrator representatives to decide how hospital resources should be used, how care should be delivered, how policies should be written. So by actively getting involved in these committees where decisions are made, hospital pharmacists can not only ensure that their voice is being heard in these leadership roles, but also ensure that appropriate medication use and safety is being considered and that patient outcomes from a pharmacist's perspective are being raised at these committees. So certainly encourage any pharmacists who are considering entering hospital pharmacy to look out for these kind of leadership positions within your hospital in order to promote the medication safety and appropriateness concerns from hospital pharmacists on a hospital level. Another way that hospital pharmacists can get involved in showing the value that hospital pharmacists can add is, of course, I'm biased through research. So there's a saying that if you don't measure it or if you don't document it, it didn't happen. So definitely by getting involved in clinical research and generating evidence for the positive impact that hospital pharmacists are having on patients, this can show hard copy evidence of the positive results of pharmacist intervention. These results can, as I mentioned, inform policy, inform guidelines, and also demonstrate the important role that pharmacists bring.
Okay, thank you very much. I think it boils down again to active participation and engagement. And yes, working in a multidisciplinary team also work to ensure that the role and contributions of pharmacists are well appreciated. So thank you very much, Dr. Liu. We've come to the end of the interview, and I'm very sure that many young pharmacists and early career pharmacists in ECPG that listen to this will get quite some insight for their career pathway in hospital pharmacy.
Thank you so much for inviting me to this interview. It's really, really nice to engage with your members and to share more about the different things that pharmacists can be doing. So really, really appreciate this opportunity. Thank you again.
So thank you very much once again, and we are glad to have you at FIP ECPG. We look forward to more engagements with you in the future. And thank you very much, everyone, for joining us on today's interview, and have a lovely day.